A new bill in Wisconsin could change what doctors are required to tell their patients about alternative treatments available to them. But not everyone is on board with the idea. News 8's Pauline Lee joins us now in our studio with both sides of the debate.
Well, right now, doctors are required to tell patients about tests and treatments for any symptoms a patient has, even if doctors don't believe the patient has that underlying condition. And while they say patient safety is their top priority, some have different definitions as to what that really means.
Most of us in healthcare are in favor of this bill just because it doesn't make much sense without it.
Kristen Lerberg is a family physician at Mayo Clinic Health System in La Crosse. She says patients don't need to know about every single test and treatment available if she doesn't think it'll help.
It's a waste of time and it scares patients unnecessarily about things that they don't have.
Now a new bill would change the law and no longer require doctors to tell patients about every alternative test or procedure if they don't think their patients need them. Lerberg says the bill not only has the potential to save time, but also money.
If a young, healthy, non-smoking patient comes in to see me with a cough, if I treat her the way that I treat her now appropriately, she's probably going to have a $120 office visit charge. But if I have to do pulmonary function testing and a CAT scan, that simple bronchitis is going to cost her probably more around $3,000.
The real world is it could have an effect on, how someone's life is affected for the rest of their life.
Attorney Joe Veenstra at Johns, Flaherty and Collins in La Crosse says sometimes patients want to know all of the options to decide for themselves.
I don't think any physician intends to not inform their patient of risks that might be inherent in a procedure or in not having a certain test, but there are these outlier cases that things happen.
But Lerberg says doctors should be able to use their professional judgment to provide the best care for patients.
We depend on that team effort between the patient taking ownership of their health, the doctors recommending the right treatments, and then these extra layers of safety that come with our technology and our communication systems that we have in place that allow us to provide that safe care without any additional risk.
Now, while health officials say the proposed bill has the potential to cut down on healthcare costs, Veenstra says it could also make it more expensive to prosecute these types of cases.
Thanks, Pauline. The bill passed in the Judiciary Committee yesterday and is now on its way to the full assembly.